Hi, I'm Michelle Tompkins, and I am here at Vein Specialist at Dr. Magnet's office in the interventional suite in the office here. Welcome. Thanks for being here with me today.
Thank you for coming out on remote here.
Now, you're going to be doing a Wellness Connection program for us on May 23rd at 3 o'clock in the Social Center.
Okay.
And you've been to Shell Point previous times, but today we're here to talk about vein disease and specific treatments. But what's one of the most common forms of vein disease that you treat?
Yeah, I think the most common presentation of vein disease is varicose veins. It's not the disease itself, but it's the most common presentation. So that's what you see mostly walking around. But the other patients may have swollen legs or discolored skin. There are patients with open wounds that are going to wound care centers without seeing much improvement. And those are other very common presentations as well that aren't necessarily tied to vein disease, in the top of somebody's mind.
Sure. So, Dr. Magnet, tell us about the various types of different procedures.
Another thing a lot of physicians and patients aren't aware of is that stripping is no longer performed. I mean, it shouldn't be. There are some in the area that still probably do strip veins, but since 2000, the technique has been to seal veins with heated catheters. Now, the newest technique was approved by the FDA a couple years ago. It's called VenaSeal. It actually uses a proprietary form of this cyanoacrylate glue, like super glue. And we basically put it inside the diseased veins, and without using heat, with only using one needle stick, this can be done in 15 or 20 minutes. That just got approved for payment by Medicare January of 18. So we're doing more of those closure procedures. And that's really the newest technique in terms of sealing veins or treating varicose vein disease. This is called the interventional suite, or what they call an angio suite. And about 2 years ago, after I went to a big vein meeting, we realized that there's about 15% of our patients who don't have good responses or adequate responses to the traditional sealing treatment. So those patients may be candidates for pelvic vein congestion or compression, and that's what this equipment is used for. You can see as we pull the catheter back, we can see where the stent was placed here and open up the narrow spot so that the flow from the legs can return without any obstruction. So this Volcano device is the intravascular ultrasound that really has changed our approach to this small percentage of patients who have venous disease that really we've been unable to adequately help. So this is the other part of the equipment that we use in the interventional suite. This is called the C-arm or fluoroscopy. It allows us to take pictures with dye, injecting in the vein that we've placed the catheter in the thigh. This is after the stent was placed. The blood flow is going without any restriction, without any obstruction, and you can see the stent that starts here and ends there, allowing the blood to flow through that previously blocked area. So this is critical to our procedure.
I know this has changed so many people's lives and given so much,
It has. I mean, there are a lot of patients, I think, that we've been frustrated taking care of because we got to the end of their vein treatment, traditional vein treatment, and there was nothing else we could do. And it's not for everybody, this technology, but it probably affects about 15% of our patients and maybe 1% to 2% of the general population. So we're excited. It really has changed the way that we approach our patients. We're still doing a lot of the other procedures. That's the primary thing we do, but we have this to offer patients as well. So sort of all the technology that's necessary for vein treatment, we can do right here in the office at Vein Specialist.
Now, when you come to Shell Point on May 23rd, what exactly will you be talking about and sharing with our residents? What do you want them to know?
I think we're going to change it up this year. We've done these talks a lot of times, and rather than being a lecture format, I think it's going to be sort of an open forum. So I'll talk about venous disease, sort of what the causes are, mostly heredity, advanced age, things like that. We'll talk about how it looks, how it presents, so we know it's just not varicose veins. We'll talk about when to treat it, why to treat it, what happens if it's left alone. Is it a medical disease or a cosmetic disease? Then we'll go through some of the treatments we do. I'll show some examples of befores and afters, and maybe show a couple of slides about IVUS, and then open it up to the audience. That's what we've done here in the office.
Absolutely.
And it allows patients in the audience to ask questions, and this patient over here may have a different question than that one, but this one is interested in their question.
Yes.
So we're going to open it up and have a little bit different format.
That's always helpful too,
Yeah.
absolutely. Well,
I can drag on for quite some time.
I can understand that. Well, Dr. Magnet, thank you for letting us come
You're welcome.
to your
Thank you,
office.
Michelle.
It's
Appreciate it.
definitely great being here. I know you have patients to see and surgeries to do, so thanks so much. Our
Thank you.
residents out there who are interested, please sign up at the concierge desk for the program on May 23rd. It's at 3 o'clock over at the Social Center. We hope to see you there. Stay well.
Yeah.